Hey, Matthew Holtz, do you have that fancy United Healthcare insurance? Because you know what? You get access to free Peloton classes, but you still got to buy the bike.
So it's all free as long as you pay the $2,000. That's kind of cheap compared to health insurance, I guess. If you're spending money on health insurance,
Do you think that goes towards your deductible? I feel like it should go towards your deductible. Find out more. It's the July 22nd episode of Health in 2.0.
I know, Jess, I have stodgy Blue Cross in Massachusetts. Who knows if they cover anything, although they now cover Brightline, which invested in them and is my kid's thing for where she gets the drugs. And they're, she whisper it quietly, but her drugs are much cheaper with Blue Cross in Massachusetts than they were with Blue Shield of California.
How are you with the Blue Shield of Massachusetts?
You know, the world is borderless, frictionless, whatever. Who knows with that?
Except all right. In virtual care, right?
in other news, you know, last week we said it was all calming down and there were no more deals.
Oh my God. Wait till you see what happens.
Well, let's go then.
All right, let's do it. You ready?
I am ready, and we are. Go.
Going. Carbon Health, 350 million. This is one of those retail clinics plus telehealth. Matthew Holt, tell me more.
It's a retail clinic plus telehealth plus it had a lot of activity. It's like 80 clinics now, most starting in California, a lot of activity during COVID, doing COVID testing. They claim that they get people into their telehealth service more quickly because they're also doing urgent care and primary care together. And you can get all three of them. And it's clearly a massive competitor now to One Medical. Takes insurance, doesn't charge you a membership fee, but it's the same kind of style and same kind of demographic in the Bay Area and elsewhere. So all these amazing, we in our conference coming up, Policies, Techniques, and VCs, going to be looking at this. All these amazing different versions of doing primary care are going crazy.
Another topic, man versus machine in mental health care. Here's one for the machine side. Woebot gets 90 million, brings their total up to 114. What does this one do?
Yeah, a bunch of people in this round, Jazz Partners, Temasek, BlackRock. I was in it too for like almost no money. A mental health chatbot, complete mental health got slated in the New York Times recently, but really cool. And it's got a breakthrough designation for postpartum depression, and it's going to scale. Interesting guys out of Stanford.
All right, 76 million for 8 Sleep, which promises optimal sleep fitness. A gazillion celebrities are in this in Khosla. What else do we know?
Nothing. Apparently, you know, if you sleep, it's like it's the next generation of Sleep Number or beds for her or something. I don't understand this, but apparently sleeping is important. If you have kids or dogs, it's irrelevant though.
All right, Aidoc, they get 60 million. General Catalyst led this one. They analyze medical images for chronic conditions. That's a little bit cool.
Yeah, I mean, this is more AI in the workplace. Can we help out figuring out, you know, to make radiologists and diagnosticians, pathologists smarter?
All right, what about OM1 or OM1? I'm not sure. 85 million. Did we get it?
We're in. Yep. Keep going.
OM1 or OM1?
I think it's OM1, but who the hell knows? They didn't
Somebody tell us. We can't say your name. We hate when that happens. 85 million they raised, bringing their total up to 170 million. General Catalyst is in this one too, along with a slew of others. D1 Capital, Kaiser's in there, 7 Wires in there. They do real world data and apply it to a bunch of different things. Tell us more.
This is another of those real world evidence, folks. And we have a panel on that one too. It's called something like Go Jump in Your Data Lake, I think is what you call it in our conference coming up. But this, they're not in it because they've never heard of them. But this is, you know, there's Aetion and Clarify and God knows how many other companies. And then the data company that the hospitals just put together, whose name I've already forgotten about, that we talked about, they got 95 million in the last one. Oh, TruVita, the one named after the stevia substitute. Yeah. Basically, everybody and their dog believes they're going to make an absolute fortune out of real world data somehow or other in order to help basically make new drugs and then, you know, help people get through regulatory approval and yada, yada. And it is true that we've done a terrible job historically of actually managing what happens in the real world of data after FDA approval for drugs. So it's good that it's all going in there. Hard for me to imagine. These guys are now raised 170 million. Everyone else I've mentioned has also raised, you know, hundreds of million. Komodo and others are in there. Hard for me to imagine that they're all going to be massive successes, because you've also got, don't forget, the old IMS Health, IQVIA, and a bunch of others. You know, IBM bought that company, True, then, and True seems to be in the word a lot. Maybe they should be called True OM1. Whatever. All right, but the answer is a lot of real world data techie companies.
Dr. True, that's it, Dr. True.
We didn't even get to the next Doctor one out of Europe, but anyway, we'll do that next time.
Gonna have to wait. It's gonna have to wait.
They all have to wait because we only have 2 minutes or longer.
I know. All right. Well, to follow along with the exploits of us, please check us out over at Twitter. I have finally recovered my account.
You're back, baby. You're back.
Yeah.
Did they tell you? Did you just one day? Did they send you an email? What happened?
This was the least helpful thing that ever happened ever anywhere. It was like a series of like form emails. And then it was like, what came back to me was just like a password reset thing. Like, that's it. And they
Well,
just
you're back and
oh my
you're
God,
learning to learn about two-factor authentication.
And it took 6 days for this. Like, two-factor authentication, you have to do it, people. My PSA. Follow along at JustAboss on Twitter, at BoltyBoy. And be sure to check out our email newsletter over there at thehealthcareblog.com. You can sign up to receive updates from the blog, including these Health in 2.0s, my WTF Health interviews, and other curated content from our contributors each weekend.
And propaganda about policies, techies, VCs, the conference. Data is launching.
I'm getting there. Hold your horses. So go to whatsnexthealthcare.com and check out the speakers and agenda on offer for our conference, Policies, Techies, and VCs. What's next for healthcare? 2 words. Yeah, agenda launched, shaping up. Everybody's in. It's happening, people. It's happening. You need to sign up, register now. This is one of those ones you got to register for. It's not one of those freebies you can drop into at the last minute.
Hey, you could do an infomercial. You must buy this car today, or if you don't fund us in NPR in the next minutes, we will lose that pledge break, the matching pledge, and you will no longer be able to hear car talk repeated for all those times, even if the guys have been dead for 7 years or however long.
We have been called the car talk of health tech.
We're still alive, although will they be repeating us on NPR like 10 years after we're dead? Thomas Getz was always complaining about that on Twitter because NPR in San Francisco was always playing car talk, and the guy had been dead for like 10 years and they're still replaying old shows.
Are you done? Because you are really car talky right now with your tangent over there.
I'm entertaining. I'm laughing at my own jokes. That's what they used to do.
Yeah, that's usually how it goes. Okay, and that's it. We are done. So people, check out that website, whatsnexthealthcare.com. Put your pledges in, sign up for your tickets, become inspired by the beautiful world of health technology. Thanks to me and Matthew Holt and a slew of others. All right, that's it. We're done. Bye.